What's up? Um, Joe Hustadi here, your friendly neighborhood physical therapist. I'm here to explain to you about why and how compression occurs and why we have pain in the human body. So, this is what we typically see in the clinic. Patients come in, they have pain, and they have lost of motion, but they're just not sure why. So, a simple explanation, because of the things that we do on a day-to-day basis, you have to understand that 1% of that comes from a disease process. The other one comes from trauma. All right, the rest of that, that's what we're doing to ourselves. So you folks that like to sit all day long, you don't move, you have a rather sedentary lifestyle, or maybe your job perhaps dictates that you sit. So whether you're a truck driver or you sit behind a computer, or for you people, especially our teenagers and young adults that like to do that with their cell phones, we see a pattern of symptoms that occur and develop because of the lack of mobility. And people that move rather generally throughout the day, they don't have any symptoms. Okay, so take for example these people that live in the Amazon, or people that live in countries where they're just forced to move because that's part of their daily activities. Americans generally are very sedentary, and as a result, we have a lot of people that are in pain. And by the time they hit their late 50s, 70s, even 80s, they're just, they become incapable. All right. So what I have here, this funky looking thing is called a tensegrity structure. This concept of tensegrity was coined by Buckminster Fuller. If you're not familiar with who Buckminster Fuller is, or Bucky Fuller, he's the architect that designed Spaceship Earth, which is basically the ball that you see at Epcot Center. All right, so it's a concept of taking minimalist parts, putting it together, creating a structure, and this is called an icosahedron. Okay, so what this represents is you have sticks. The sticks represent the skeletal system, and the rubber bands represent the connective tissue, the muscles, the ligaments, and the tendons. So if you pull on this, you can see how everything moves. And because we have tension throughout the structure, it gives the structure a rather uniform look. All right. The tension is equal and it's loose. All right. So let's say if a person does a lot of sitting, their hip flexors shorten. Or if you look down a lot, these muscles shorten. So we will use this as an example. So as that tissue shortens, you can see how the bones start to shift. Okay, so now it's a little bit more crooked than before. What most people fail to realize is the tension has increased throughout the structure. Okay, so these are the people that sit. Now that individual has to stand up and move, all right, and then they compensate by stretching and using another muscle. And they think they're upright and moving about, but look, it's a little bit more crooked and it's not moving as much. All right, you can even argue that you can add another twist to the rubber band and this thing is really going to get tight. So most people tend to operate right here, right? They can't move. You're not going to treat this with pain pills. You're not going to treat this with heating pads or ultrasound or electrical stim if you're a physical therapist. Okay, what you do is you identify the fact that, hey, you're not moving, your posture is off, and by the way, that muscle is tight. So let's loosen up that muscle. And you can see that sprung out of its position. And you take away this tension as well, and the structure goes back into its symmetrical form. All right, so that's for this structure. Now, let's take those postures as an example. These are called anatomy trains, designed, conceptualized by my mentor, Tom Myers. And these illustrate the long lines of tension that hold the body in the upright position. This is a two-legged animal, operates on 2 feet, upright. Nothing looks like that. Nothing else looks like that on the planet. There's 7.2 billion of us right now, and but only a few of us actually move about on 2 feet in the full upright position. Normal posture is that, folks. Normal posture is perfect posture. If you don't have perfect posture, you have a rounded upper back, or perhaps one of your knees is not straight, right? You're gonna get crooked. All right, maybe that's not a good example here. We'll make it more dramatic. All right, so there, compression. So you take away the compression, you restore posture, and if you have an efficient posture, organized like that, the head over the neck, or the spine rather, the torso over the spine, over the pelvis, over the legs, over the feet, gravity will pass right through that structure right there. All right, and imagine if your head stuck out like this, gravity would pull on that, and thus will give you neck pain. Another example of compression, do this to yourself, okay? Rest your elbow on the table and move your wrist back and forth like that. That's nice and loose, isn't it? Okay, because the tissues are loose. What if I grab the tissue and shortened it? Look what happens. Ooh, now I have compression. I have compression, but I also have torque. All right, so if I twist that, see that? See what happens? It compresses it and it torques it. Now if I move it, ooh, I've just lost motion. In more chronic cases, you create inflammation in the joint, then you have pain. So, physical therapist sees that and they say, wow, you're tight, you're stiff, let's loosen this up. So we take that and we loosen this up, and maybe we'll go all the way to the fingertips. And once that's loose, you're back to normal movement. And the irritation of the joint disappears. So it's a simple concept, and the approach can be a little difficult, especially if you're not sure, or you have a good working knowledge of anatomy or manual therapy for that matter. But people live nowadays in a situation where they live with chronic pain and they just think it's aging. And the good news is you're not supposed to age and have pain. That's pain is a whole separate entity which should be explained. We can explain these things now. So hopefully this concept of tensegrity, compression, loss of motion, pain, and dysfunction is something that you can learn to identify within yourself. Treat it if you can, and if you can't, go see a massage therapist, a physical therapist, or a body worker like a Rolfer. All right, stretching sometimes will not be enough. This is not a weakness issue. You do not strengthen tight muscles. You loosen it up, you become aware of your posture, and try to operate in the upright position on 2 feet, because you're that kind of animal. All right, thanks for stopping by. I'll talk to you guys later.